What is the primary purpose of donning and doffing personal protective equipment in a specific sequence? So this is referring to when you put on PPE, donning, or taking it off, doffing, that you put on your gloves, your gown, your mask, and your goggles in a specific order instead of just however way you choose to do it. So let's go through the choices to understand why. So option A says to maintain sterility of the equipment for future use. So when saying future use, typically PPE is not to be reused unless we're in some sort of crisis shortage situation. It is for one-time use to keep yourself protected from an environment. And also, it's not used for sterility of equipment. PPE is used for self-protection or protection of the patient, depending on what it's used for in the medical environment. So therefore, we could eliminate option A. Option B says to ensure a comfortable fit for the healthcare worker. And this is incorrect because the order has nothing to do with how it feels and how it fits. You might have a certain feel or fit in terms of the type of gown you use, maybe, the type of mask you use, maybe, but this is discussing the primary purpose of the specific sequence. Also note that the question says primary purpose, so it's possible that the comfort level of the healthcare worker might be a factor if someone finds it more comfortable going in this correct sequence for some reason, but it's saying primary purpose. So what is the main reason why we're doing this? Option C says to minimize the risk of self-contamination during removal. And that's absolutely correct because look at this, self-contamination. The whole purpose and reason for wearing personal protective equipment is to protect the healthcare worker in most cases from the patient and anything in the environment that could harm the healthcare worker that could potentially be spread to other patients. And therefore, we want to do everything in our power to avoid any form of contamination. And if you don't doff your PPE and take it off in the correct order, you might accidentally contaminate yourself. For example, if you take off the mask right away when you get off, then in your airway, you might become contaminated with anything that's on your gown because you didn't do it in the correct order. Therefore, we want to minimize this risk by taking off the PPE in a specific order. So that's option C. But let's look at option D as well. This says to create a sterile environment for the patient, and no, wearing PPE does not equal a sterile environment. That would mean using sterile gloves, having a sterile field for the equipment, but wearing PPE is different than creating a sterile environment. Therefore, we could eliminate option D as well, and our correct choice is option C, to minimize the risk of self-contamination.